Good afternoon and a very warm welcome to the Cutis Dr. Sylvia Answers series. I hope you're all well, happy and safe. My name is Gunther. I'm the Managing Director of Cutis Medical Laser Clinics. And what we would like to do today is a live discussion about a topic that we have received many questions about. And the topic is Ultherapy. Usually the Dr. Sylvia Answers series is answered in short videos that we produce, and that gives kind of a short overview of the question that our patients or anyone actually has. For the particular topic of Ultherapy, we thought that there are too many questions that are coming in, and that's why we wanted to try this format of a live discussion. We are now at the end of May, and I'm sure that you have heard that aesthetic clinics are not allowed to continue their services or start their services after the circuit breaker period June 2nd, which is obviously disappointing for us, but it also gives us the opportunity to further develop materials for education for our patients and for the public in general. We're going to have a webinar next week about collagen. So that's a whole topic about this wonder keyword, collagen, the buzz that is out there. And we're going to follow up with additional webinars in the future in early June about fillers and volume and all the myths about fillers. But today we want to focus on one particular treatment that has become the gold standard, I would say, and that is Ultherapy. And for that, I'm very happy to welcome our expert and panelist, Dr. Sylvia. I'm sure many of you know already Dr. Sylvia, but let me just give a brief introduction to all of you. The majority of her medical and clinical experience, Dr. Sylvia has received in the US, mostly in Boston and New York. Her focus was on pediatric nephrology and pediatrics, for which she has also received the board certification. Since she started Cutis about 12 years ago, her focus has been mostly on the scientific approach of aesthetic, with a diploma in practical dermatology from Cardiff University, and most recently a master's in facial aesthetics with the Anglia Ruskin University. She has also published numerous scientific papers and is also in the process of publishing some in the field of aesthetics that's going to be coming out, I guess, later this year. And welcome to you as well, Dr. Sauria.
Thank you very much, Gunther. I appreciate all of you for hanging in there and waiting for us to reopen. As Gunther mentioned, we're not able to do aesthetic services, but we're here for you to answer your questions.
Great. So, Ultherapy, that's the big topic, and we've received quite a number of different questions that I have for you. But before we go into the specifics of Ultherapy, let's just take a step back maybe, and if you could explain to us the process of aging, what actually happens when we age.
I discussed this in last week's webinar, but I think it's important to always look at a treatment in relation to what happens to our faces as we get older. Usually I look for 4 different factors when I'm assessing and consulting with a patient. The first is looking at skin quality. Broadly speaking, changes in skin quality can impact pigmentation and thinning of the skin as we get older. The second would be sagging and laxity, and this is now attributed largely to loss of collagen and elastin in the second layer of the skin, as well as in the layer of the skin called the hypodermis, particularly a ligament that holds the skin in place known as SMAS, which I'll cover more next week. In addition, the third component are muscle changes, and when we think about muscle movements on the face, we want to look at both upwards and downward vectors, which muscles contribute to that, because over time, repeated downward movements can create or contribute to laxity or sagging, especially in the jawline area or even the droopiness of the eyelids. The fourth component would be changes in the volume characteristics of our face. Typically, it's a very selective loss of volume. We lose fat pads and also bony changes. And together, these make us lose support for the rest of the remaining fat on our face, leading to laxity and the characteristic changes of aging.
Great. One point I forgot to mention earlier is we are also live streaming on Facebook. So if you have any questions, send it to us on Facebook, and I'll try to incorporate these questions in this discussion here. I hope I can figure out how that works, but just, maybe send us a comment on our Cutis Medical Laser Clinics Facebook page. Now to the first question about Ultherapy's role in this aging process. You've described the various processes that happens when it ages, but where does Ultherapy fit in that?
Ultherapy is a treatment that applies to the first two components of aging. So remember, all of these four components happen to all of us, regardless of gender, regardless of ethnicity or race. But the degree to which each of these components contributes differs from person to person. But where Ultherapy works is the skin quality, as well as the collagen building to address skin laxity. Ultherapy uses ultrasound waves, and so most of us are familiar with ultrasound. If you've ever had a baby and have become pregnant, ultrasound is used to image very deep into our abdomen. It's also used, for example, for breast cancer screening. In this case, Ultherapy is using ultrasound waves, which are converted to heat of a specific temperature. This heat leads to tiny changes in the dermal layer as well as under the dermis, so this layer known as this mask layer. And our body's healing process results in collagen building, which in clinical studies has been shown to continue up to a year after the procedure. And so we recommend Ultherapy typically for correction or improvement of laxity. Generally, that can appear as droopiness of the lids or loss of definition of the jawline, the neck, the décolleté area. And we're actually in the midst of doing a study to look at the role of Ultherapy in combination with a biostimulating filler to tighten the arm skin. It has a lot of potential applications, but really where we notice the first changes where we recommend Ultherapy would be the jawline area. Okay,
a question that has come up here targets the number of treatments that you need. One patient here or one person has mentioned that skin tightening treatments require monthly treatments. And is this also the case for therapy, or what sort of the frequency that you would recommend for therapy?
It varies from person to person, but as I mentioned earlier, Ultherapy has been shown to result in collagen building up to a year after treatment. And actually, when you do the treatment, when you do Ultherapy, you don't see the result right away. So it's very different, for example, as compared to fillers. You need to have a cumulative number of collagen growth in order to see a lifting or improvement in response. And typically we say it's a minimum of about 3 months or so. But there are some other treatments, some other older lifting treatments where you do need to do it more regularly and more frequently. But generally speaking, an average person, a typical person who would come to us to start an Ultherapy would be between early 30s to mid 50s or even up to the late 50s. That type of profile on average would need about a single treatment per year. We do have some patients who only start treatments, especially collagen building treatments, later on in life. And in those cases, or if we're seeing a little bit more changes or a bit of an accelerated aging curve, we may recommend 2 treatments the first year and then once a year thereafter. This has not been looked at, but our sense, having had Ultherapy for a few years now, and the vast majority of our patients do this on the clock once a year, is that the improvement is cumulative. It tends to seem a little bit better the next year and further better in subsequent treatments.
So the number of treatments is age dependent? Is that how you would describe it?
To a certain extent, yes. And in fact, for example, when a person comes at 30, we would change the protocol a little bit because that person probably does not require an aggressive treatment as compared to someone who's never done anything before and comes to us at 50 and may therefore need the full protocol based on clinical studies of Ultherapy.
So the change of protocol, is that other than age dependent, is that also dependent on other factors like male, female, or Asian, Caucasian?
Yeah, that's a superb question. And so the way I would answer this question is to look back at the 4 components that I described. A lot of that relates to skin quality and laxity. So what are the contributions of these versus the contribution of volume change, which is very different for Asians and Caucasians, mainly because of differences in our skin characteristics. For example, we know that Asians on average have a bit of more sebum production and probably a thicker dermis. There's also a little bit of a heavier fat pad on certain aspects of the face. That type of profile may need a bit more sessions and a little bit more intensive treatment. On the other hand, an average Caucasian person who comes to us, let's say a female, generally the facial shape is sharper and may manifest with some hollowing and loss of volume, even in the lower part of the face. In that case, you want to not target the fat pad layer, and this is very important. You want to use the imaging ability of Ultherapy to target the correct layer, which is the SMAS layer. So oftentimes what I'll do is I'll use what seems like a shallower layer, but in fact for someone with less fat on the face, that's already a deep treatment. And so we modify it on the person, we modify it on the contribution of volume versus true laxity. And we develop, because it is technique dependent, Ultherapy is not the same for everybody. We then modify it depending also on what we see when we're imaging with the ultrasound, the imaging component of Ultherapy.
Right, that fits very well into the question here that we have, whether Ultherapy treatments is the same anywhere you go. So what I hear, it's not as simple as just switching on the machines and doing it. So there is some customization and individual approach to doing the treatment. Is that correct?
Yes. Now, in general, it's a very straightforward treatment. We do follow what's published in the clinical literature in regards to what's been shown to result in the best improvement in terms of lifting. But you do need to modify it because we have patients where the face is so sharp and so hollow that in that case, you want to go, as I was saying earlier, a typical treatment, which starts, I usually start with a deeper treatment. It's a 4.5 millimeter treatment that goes into the SMAS or hypodermis, which means under the dermis layer. In cases where when we image and we see that, hey, this is already, the 4.5 is a bit too deep. You want to go above the muscle layer, and perhaps we would need to start only with a 3 millimeter layer and add instead the shallower 1.5 millimeter layer. There is a high degree of customization of Ultherapy for sure. It is technique dependent.
That is interesting, because one of the questions here also talks about melting fat on the face. Would that happen when you select the wrong depth for a particular patient? Is that the case?
So first of all, in all the clinical studies on Ultherapy, there's never been an actual demonstration or an adverse of melting fat on the face. There's never been any study that has shown that. But it is also the case that you want to make sure that when you're doing the treatment or the treatment is being done on you, that it is targeting the layer where you want to build collagen. You don't want to go too deep under the muscle where there are deep fat pads on the face. We don't want to affect that layer. So very important to watch the camera as you're watch the ultrasound as we're doing the procedure in order to make sure we're targeting the best layer to give the appropriate outcome.
Great. One question that we have received from different people is about the pain. So there is a myth out there, I guess, that Ultherapy is very painful. Is that the case?
Yeah, so this is, I think, because of two things. One, it does go quite deep. And the depth of it, or even when I'm discussing with a patient, they already can envision it must be quite uncomfortable. So the fact that it's one of the probably the deepest skin tightening treatment available today that is not invasive, that there's an image that people believe that this is probably a painful procedure if it works. The second is the first generation of Ultherapy had a very different treatment temperature. That temperature was significantly higher than what it is today. So Ultherapy has undergone significant improvements in order to make the procedure more tolerable and less uncomfortable. Also, they've shown in clinical studies that reducing the temperature, now it's 65 to 70 degrees, it used to be much higher than that. They were able to show in clinical studies that this reduction in temperature does not compromise collagen building, does not compromise outcomes for so long as you do the number of pulses or lines, we call it, and you don't shortcut the procedure. And so what that means is that it's become less uncomfortable. It also, as we've seen, the discomfort varies from person to person and from area to area of the face. I will tell you right now that all of our patients tolerate it. All we do is put a topical numbing cream, give some Panadol or ibuprofen if a person is not allergic to it. We recommend that they're distracted, so listen to a podcast or watch a film. But really, it's a procedure that is highly tolerable in all of us. And I totally believe in this procedure. I have it done, although it's recommended as once a year, I have it done twice a year because I want to minimize the need for more invasive procedures as I get older.
And I think we agree that the results speak for itself.
Yeah.
A question that has also come up quite often from different people is whether Ultherapy is actually the same as other HIFU machines out there. And I guess HIFU is the high intense frequency ultrasound, which is basically the technology that also drives Ultherapy. So is this comparable?
HIFU is in fact correct. It's similar. It's high intensity focused ultrasound. I will say that there are several differentiating factors. What to me presents as a good treatment versus an unsure treatment. What's a great treatment versus something that's not proven. And for a large part, that is going to be the clinical studies, the fact that they're US FDA approved. You know, Gunther, in the field of aesthetics, these are elective procedures. These are not life or death treatments. Because of that, you want to be especially careful that what you're doing, what you're having done to yourself in order to create a better outward appearance is proven, that the risks are really minimal, especially for elective procedures. Ultherapy, as compared to HIFU, is the treatment that is backed by clinical studies. HIFU per se, I look at them really as copies because yes, they may feel that they're using the same ultrasound technology, but have they been evaluated for safety and effectiveness? Have they been evaluated for the steadiness, stability of that temperature? Well, Ultherapy, one of the strengths I mentioned earlier was it emits a stable 65 to 70 degrees centigrade, which has been found to be a good temperature, an optimal temperature for collagen building. And you can imagine that anything that's too hot could result in more complications and side effects and potentially burn, especially if applied incorrectly. And if it is not hot enough, because we don't know the actual temperature of HIFU, whereas Ultherapy we know. If it's not hot enough, you may be getting suboptimal results. The last very important part of Ultherapy is its ability to image. I talked a lot in the first 10 minutes of this discussion about imaging and looking to see that you're in the correct layer. HIFU does not have imaging. Ultherapy, we rely a lot on imaging in order to target the right tissues for lifting and tightening. In fact, there was a publication a couple of years ago where HIFU was used to create a lifting in order to correct a droopy eye. And in that manuscript, it was a case study. The patient had a cataract because the HIFU, because of the lack of imaging, actually the ultrasound waves passed into the lens of the eye. And so that would not happen with Ultherapy if you're doing it correctly, because you're looking very carefully on the camera. Where are you in relation to the bony structures of the face? And stay far away from vital structures such as the eye, for example. And so for those factors, really, if you're going to do a procedure like this, which is safe in the right setting, in the right system, the right machine, and with the right physician, treating physician, who you want to go to someone who's done a lot of Ultherapy, because as I mentioned, there are some varying parameters that we apply from patient to patient. So in that setting, you could really get the benefits of this procedure.
Great. So now, last question that I have here, and then I'm going to check whether there are any questions on Facebook, is really about the combination of Ultherapy with other anti-aging treatments, I reckon. So we've heard where Ultherapy fits into the aging process and how it can help to prevent aging. And you mentioned earlier that you are doing a study with a filler, I guess. So what is really the best combination of Ultherapy and other anti-aging or age management treatments?
I talked about the 4 components. Every person has a different level or different degree to which each of the 4 components contributes. So, for example, if I were to look at your face today, if I look at skin quality, check. Laxity, I leave out. Muscle movement, you look great, right? You've been maintaining very well. Volume, great also. So in someone like you, I would probably recommend Ultherapy as a first step. On the other hand, in a person where it is volume that shows more of the changes, hollowing, lack of tissue support on the outsides of the face, downward migration, looking at the tear trough, that person I would probably start with a filler first so that they can get the improvement. But also in the end, it depends on the person. What are they more comfortable starting with? Because even if a person needs fillers, you cannot go wrong with starting with a procedure like Ultherapy first. The other thing, because of the 4 components, you want to make sure you're dealing with every single one of the 4. If you just chase one, there's no single treatment that can improve all 4 components. If you're only stuck on doing one, I give an example, fillers. You're stuck on fillers. Over time, you will need probably more and more volume in order to plump up, lift up, and all of that. And in that case, you want to just make sure that it's not beginning to make you look different. And so often what I say, it's a combination. You want to address everything, improve the skin while you're correcting the volume, while you're reducing the muscle pull, while you're making sure the outward appearance and the quality of the skin is as best as it can be.
Great. Now I would like to come to our question here on Facebook, which asks is whether we can do Ultherapy after surgical facelift. Is that possible, or are there some restrictions to that?
Yeah, actually, there are 2 things. I want to make sure that the wounds are all healed, the swelling is all down, probably at least 6 months out, and it has to be done in discussion with your surgeon. So if it's fresh, we want to make sure your plastic surgeon addresses this and clears you. Now, it is actually important to do it after plastic surgery. They don't replace each other. They complement each other. Because when you do a surgical procedure and you're cutting excess tissue, repositioning the skin, you are not improving the skin quality. You're not building collagen. In fact, that's one of the concerns. When you look at actors or actresses who have had facelifts in the US and have not done anything else, the skin appears waxy and almost too shiny and thinned out because these people have just resorted to surgical approaches without thinking, well, how can I prevent the need for a second facelift? So you look at Ultherapy as complementary to a facelift, but you want to make sure, one, that it has fully healed, clear with the plastic surgeon, and second, there is no residual swelling. The reason is if there is swelling, the layers of the tissues are distorted. You're not going to be able to target the right layers that you want to improve. And so the healing, it has to be fully healed, no swelling. Then you can think of it as more maintenance in relation to after your facelift.
Great. I think that wraps it up, our session on Ultherapy. I hope we have answered all your questions. Thank you very much for joining us, and stay safe and stay healthy. Until the next time. Bye.
Thank you.